Hi everyone, today I'm going to be doing the catheterization setup video. So when I'm reviewing this, I need to start with the healthcare order for my client. So I'm reviewing my client's order here. My client is Jane Smith, 36 years old. I see the healthcare order here for an indwelling catheter for urinary retention. I can see here that they have no allergies. Specifically, I'm looking for latex. This would be a hindrance to the catheterization. I also looked through her record here and I saw that there was no recent trauma to the area, no surgery, as well as no obstructions. These also would be hindrances to the catheterization. From here, now that I've confirmed the order and see no hindrances to the process, I can go and see the patient. Hi Jane, my name is Zala. I'm the student nurse. I'm going to be doing your urinary catheter procedure today. How are you? That's good to hear. So while I talk to the client, I'm going to perform my hand hygiene. I made sure that the door was closed and I've introduced myself so there is privacy. So Jane, could you please state your full name and your date of birth? I'm going to check her wristband against what I have on the MAR. Okay, and your date of birth. Thank you so much for confirming that for me. And Jane, can you tell me if you have any allergies? All right, awesome, good to hear. So she's just confirming no allergies to latex, which would be a hindrance to the catheterization procedure. And she just confirmed to me that there was no additional allergies that weren't showing up on the MAR. So today we're going to be doing a catheterization procedure. We're going to be putting an indwelling catheter in. This is for your urinary retention, so how you haven't been able to fully empty your bladder. We've spoken about this before. And this this catheter will remain in place for a little while. So if you have any questions about that, we can definitely speak about that after as well. But at this time, do you have any questions? No? Okay, awesome. So at this point, I can gather all of my equipment and I will quickly go over here and grab it. So for this procedure, I'm going to be using my Foley catheter tray. I'm also going to have a waterproof pad for under the client. There is another drape that's in here as well. I'm going to need some clean gloves. I also have a trash can that's close by between me and the client. And then what's in this tray will be just explained when I open up the kit. But quickly, it's tray, forceps, lube gel, syringe, cup, the towel, the drape, the waste bag, CSR wrap, and then there's also the catheter in here as well. So I'm going to position the bed, but before I do that, I'm going to do my hand hygiene. And I'm going to put clean gloves on. For the sake of the video, I don't have any extra ones, so I have clean gloves on. I'm going to position the bed so that it is at a good working height for myself. So this is my mattress, I can't move it, right? My client is a female, so the best position for a female to be in is dorsal recumbent, so on her back. So I would recline the head of the bed and their knees would be bent. The knees would be flexed. They would have a blanket that would be draped in a diamond, and I can flip the diamond back. So what would be showing is a urinary meatus. Everything else would be covered for modesty. If it's too dark, you can use the pen light. Also in the Foley kit, there is a drape that you can put on that will just show you the urinary meatus. So everything is super clean, sterile, and you're just focusing on that one area, especially with the pen light, so it'll be easier for access. So client is ready, no questions. I can go open up my sterile kit and then I can proceed with pericare and then the catheterization. Okay, so I have discarded the clean gloves that I used to position the client, and I've performed hand hygiene as well before I'm going to be opening up the sterile Foley catheter kit. So just to quickly reiterate, the tray, forceps, cotton balls, the lube, the syringe, the cup, towel, drape, waist bag with tie, CSR wrap, and then there's also the catheter that you pick for the sizing and the gender of your client as well. And this has the stuff for the pericare and then the actual catheterization. So this is an invasive process, so we need to keep everything sterile. So we're only going to be touching the 1-inch edge of the sterile packaging inside, and even just this outside here. So I'm going to just use the edges, pull the top over. Then I'm going to grab the side here as well, pull that out, only holding the edge, holding the edge of this side as well, and then letting this one hang over the side. In these kits, they have sterile kits. Usually they're in like a folded packaging. Mine didn't come in that, but I will show you the demonstration of sterile gloves here. So there's a little cuff here that's folded over. I'm gonna get my dominant hand, okay? And my hand is holding it on the cuff side, so these are sterile. Put my hand in here, just touching the cuff. Okay, perfect. Next, I'm gonna be putting my 2 fingers into the cuff of the other hand, okay? To remain sterility. Okay, perfect. I got both of my gloves on as well. So the correct catheter size for my client that is a female would be 10 to 12 centimeters. So this is the packaging for my client's catheter. I'm gonna open it up and I'm going to be putting it in the tray. So I need to have sterility when I'm touching everything in here as well. So I'm only gonna be touching the edges. So this is the cloth that I'll be placing under the client. Just touching the edge, I'll ask the client to lift their bum. And I'm going to place it under here, and then I can actually move my kit to this piece of paper here. Sorry for the room, but I'm just going to put it over here. In here, I also have this drape here, just touching the edges. This is going to go between the client's legs. This is just going to show me the urinary meatus. Okay. In here, I also have the cotton balls, the forceps, that's going to be for the pericare that I will use before I actually do the catheterization. I'm going to put the catheter in here, and the lubricant is in here as well. It would be for the tip for easier access when you put it in. Thank you so much for watching.